Hey guys, welcome to this INI-CET May 2026 recall exam. Today we'll discuss forensic part, and I am Dr. Gautam Biswas, Professor and Head DMCH Ludhiana. Let's begin. The questions this time, they are not very tough. Again, most of them, they are repeat of previous years and you must have done pretty well. So let's begin with question number 1. It is based on the examination of rape survivor, and it covers the MTP Amendment Act as well as the POXO Act and part of consent also. So let's begin. A 16-year-old rape survivor presents at 16 week of pregnancy. All of the following are responsibilities of the examining doctor, except you have to find the odd one out of all the 4 options. The options are A, fetal tissues for DNA to be preserved, B, inform the police, C, MTP, if needed, can be conducted by one doctor's opinion. So whether the MTP can be conducted by one doctor's opinion, and D, parents' consent for medical legal examination. So whether it is required or not. So let's discuss the options. Fetal tissues for DNA to be preserved. Yes, it is important that you preserve the fetal tissues for DNA evidence. Inform the police as the patient is below 18 years. So you need to inform the police. Police information is mandatory as per the POXO Act. Patient is minor. But for conducting the MTP, you need the consent of the guardian for conducting MTP. The guardian consent is required. MTP, if needed, can be conducted by opinion of one doctor. Yes, up till 20 weeks, a single doctor can opine for this MTP. Beyond 20 weeks, 20 to 24 weeks, 2 doctors. And beyond 24 weeks, a medical board. So this is also correct. Parent consent for medical legal examination is not required. For this is, you have to make a distinction between it's a medical legal examination. It is not the consent for MTP. For medical legal examination, a person who is more than 12 years can give consent. So this is the wrong option. So answer here will be D. Now to recap what we have discussed, up to 20 weeks, one doctor, 20 to 24 weeks, 2 doctors' opinion is required, and more than 24 weeks, it's a medical board. So in case of substantial fetal abnormality, in case of pregnant women, special categories like minors, rape survivor, 20 to 24 weeks, they can go undertake MTP. And if there, in case of any emergency, any doctor, one doctor can do that in case of any emergency cases. The next question is image-based question. The question number 2 is the injury shown in the image is best described as. Just observe the injury as which has been provided to me. The option given here are A, laceration, B, contusion, C, stab injury, D, bomb blast. So observe the injury carefully. You can see here, it is irregular margins are there like this, with the tissue nerve bridges can be seen in between. And there are some contusion around it. You can see the contusion here. So what do you say? Contusion here, you can see the skin is intact. Here the skin is not intact. Along with abrasion may be there in contusion. In stab injury, it is the margins are regular and depth is more than length, which is also not seen here in the image. Bomb blast, there are multiple things which are there. It may be laceration, it may be abrasions, contusions, multiple injuries may be there. So it is also not bomb blast. So it's not a stab injury, not bomb blast, not contusion. It is a laceration injury. The correct option will be A here, right? Irregular margins, tissue bridges are there, contusion is there, and foreign material may also be there. Now coming to the next question, that is question number 3. Following an explosion, a person sustained burns to the face and chest. What type of blast injury is this? I've seen that in recent INI-CET, the blast injury is invariably asked. So you should be knowing what are these primary, secondary, tertiary, and quaternary blast injury. These are the options given A, B, C, D. So let's examine the first. What are these? Primary blast injury is because of the blast wave or overpressurization wave. Causes injury to the hollow organs like GIT, lungs, tympanic membrane rupture is there. Secondary blast injury is because of the shrapnel from the bomb, the glass particles, the particles that comes with the explosion of the bomb. So they are the maybe penetrating or blunt injuries. It can be lacerated wound, abrasions, contusions, and there may be punctate tattooing. Which is known as the Marshall striate. So they can be penetrating or blunt. Tertiary blast injury is because of the person because of the bomb blast, the person may fell onto the physical object, any physical object, and he may sustain injuries like fracture or head injury. Fracture or head injury. It can be intracranial hematomas. Quaternary blast injury is that category of injury which doesn't come in any of these 3 categories. When we are not able to categorize any of this injury in either of these 3, primary, secondary, or tertiary, we categorize or mark it under the quaternary injuries. It can be burns, it can be exacerbation of previous injuries, complications. So they come under this quaternary blast injury. So the question asked is that burns to the face and chest. So it will come under D. Answer will be D, quaternary blast injury. So just a recap of what we discussed. This is the primary because of the blast wave, secondary because of the shrapnel injuries, the particles from the bomb itself, glass particles will cause secondary, tertiary injury because the person is thrown onto some object which will cause this tertiary, and the fourth one was the quaternary. Now the next question is, which type of injury is characterized by the sparrow foot pattern? Sparrow foot pattern. The question is asked is where you find this sparrow foot pattern. The option given here are A, bomb blast, B, motor vehicle accident, C, contusion, D, collision. So sparrow foot injury is also sometimes known as dicing. Dicing injuries. They're always related to road traffic accidents. They are caused by tempered glasses. Windshield, when it shatters, it breaks into small pieces, which causes this type of injury. Dicing injury, sparrow foot injury like this. They're small lacerations with their sparrow foot pattern, which is seen over the face and the chest. Mostly it will be on the right side of the driver and left side of the passenger, front seat passenger. So answer here will be B, that is motor vehicle accident. Clear? So this type of injuries that you see in motor vehicle accidents, sparrow foot injuries or dicing injury. The next question is, match each of the poison with this characteristic feature. It is an easy question. Again, I can say it's a repeat question. You have to match the poison which is shown given here in column 1 with the feature which is there in column 2. So carbon monoxide poisoning, organophosphate poisoning, phosphorus poisoning, cyanide poisoning. On the other side, it is mentioned smell of bitter almond, pinpoint pupils with secretions, cherry discoloration, and garlicky odor. So again, it's an easy question. Carbon monoxide poisoning will give cherry red discoloration because of the formation of COHP, which gives a cherry red coloration to the skin as well as the blood. Organophosphate poisoning, we have pinpoint pupils with secretions. There is meiosis is seen as well as there is excessive secretions in OPC poisoning. Phosphorus poisoning, the white phosphorus will give the classic garlicky smell. Garlicky odor. The garlicky odor is seen in phosphorus poisoning, white phosphorus, particularly with white phosphorus. And cyanide poisoning will give a bitter almond smell. So correct option will be A3, B2, C4, and D1. So D is correct. Right? So this kind of picture is seen in OPC poisoning as well as opium poisoning will have this pinpoint pupil. And this is the in case of CO poisoning. Cherry red discoloration. It is a brain which shows the color is cherry red in color. All the blood as well as the lungs and all, they will have this similar picture, cherry red coloration. Now coming to the next question. Question number 6. A male traveler from Afghanistan is found dead in a hotel room. Autopsy shows the stomach packed with foreign substances. What is this phenomena called? The option given here are A, body packing, B, body stuffing, C, body storage, D, body smuggle. So you can see the image here, it is virtual autopsy image. What do you see here? The small packets which are there can be seen all over the GIT. Now, in this option, body smuggle, body storage, that we can remove this kind of words are not there. So we can cancel this 2 words. But can see a little bit of confusion maybe there about body packing and body stuffing. Both can be correct. But if you go through the detail of it, body packing is if you like differentiate the two, if you differentiate on the basis of intent or the packaging material and the quantity. So in intent in body packing is there, it's a deliberate intent, is the pre-planning is there in body packing to smuggle the drugs. So that is, intent is seen in body packing. The quantity is also more and the intent is to smuggle. So they act as drug mule in body packing. In body stuffing is that all of a sudden if a person is caught, then he will try to hide those things in whatever material he can, like maybe an aluminum foil, plastic bags, maybe whatever. So that intense, the quantity is also small in body stuffing. So You can see here the packet, they're neatly arranged packs, they're made. So we'll go with body packing. Answer A will be correct in this situation. The next question number 7. After ingesting a liquid, a patient presents to the emergency department with pinpoint pupils, respiratory depression, excessive salivation, bradycardia, sweating, and lacrimation. What is the treatment of choice? Again, it is a repeat question. If you have gone through the previous year's INI-CET recall exams, the videos, you would have, you know that it's a recall, or it's a easy question, or it's a repeat question. So option given here are A, pralidoxamine, B, atropine, C, flumazenil, and D, naloxone. You should be able to answer. The signs and symptoms mentioned here are pinpoint pupils, respiratory depression, excessive salivation, lacrimation, and sweating, as well as this bradycardia. So they are all features of OPC poisoning. And what is the treatment of choice in OPC? It's should be atropine. Atropine blocks the muscarinic receptors, the action of acetylcholine, and all these features, they will come down. The patient will feel better with atropine. So it is the primary choice for treatment. Pralidoxamine is an adjunct. Add to it to reactivate the acetylcholinesterase. Flumazenil is for benzodiazepine poisoning. And naloxone is for opium or morphine. So correct option will be here is B. Remember, these are the symptoms which is known as sludge in OPC. Salivation, lacrimation, urination, defecation, GIT distress, and emesis. Right? Now coming to the next question, it's again an image-based question. Nowadays, image-based questions are asked quite a lot. So you should be like well versed in going to the emergency and to the clinics. So based on the image, what is the range of firearm wound? The option given here are A, close shot, B, contact shot, C, exit wound, D, distant. So you can see from the image here, it is a circular wound with side abrasion is there, and a grease color will be there around. So abrasion color is there and a circular wound. But there is no tattooing, or blackening. It is not there. So in close shot, what will happen? You will have this is a close means it's near about within few centimeter. We'll have tattooing, blackening, and abrasion and grease color will be there definitely. In contact wound, there may be a muzzle impression. The margins may be everted. The blackening and tattooing will not be seen. It will be there in the depth of the wound, as well as it may be a little cherry red color because of carbon monoxide in contact injury. Margins will be everted. Exit wound will be there where abrasion color or grease color will, everything, the tattooing and all will not be there. And distant wound where we'll have only abrasion and grease color, which is seen here in the image. So here we'll go with D, distant. Only when you see the abrasion color and the grease color. But you have to keep in mind that this tattooing and blackening, they may be filtered out by the clothing of the person also. So you have to examine the clothing in such cases. The next question is question number 9. An infant ingests a pesticide. Which drug reverses the acetylcholinesterase block? As you are aware, in OPC, the OPC blocks the enzyme acetylcholinesterase. So which out of this compound will help in reactivating the acetylcholinesterase? This is the question. The option given here are A, palidoxamine, B, atropine, C, flumazenil, and D, naloxone. We have discussed earlier also that in OPC poisoning, what do we give? Palidoxamine and atropine. Atropine is useful. It's for immediate treatment. And it reverses the muscarinic block, muscarinic receptors. It acts on the muscarinic receptors. The action of acetylcholine is reversed. So the salivation, the sludge part is taken care of by atropine. When the muscarinic receptors are blocked, the salivation, lacrimations, and all the urination, the symptoms, they are relieved. The excess acetylcholine will not act. But to reactivate the enzyme acetylcholinesterase, we require palidoxamine. So it reactivates acetylcholinesterase and specifically reverses the acetylcholinesterase block, and is effective, most effective when it has not aged, when the enzyme has not aged, that when it has not become an irreversible bonding. So this is used in treatment of OPC poisoning. Flumazenil, as already we have discussed, is for benzodiazepine. And naloxone is for opium, morphine, heroin. They are the antidote. So correct option here will be A. Palidoxamine reverses the acetylcholinesterase block. Now coming to question number 10. Respiratory depression is not a feature in which of the following poisonings? The option given here are A, gelsemium, B, strychnine, C, opium, D, dhatura. So let's examine the option. Gelsemium is a plant poison. And it causes CNS depression, paralysis, as well as it will cause paralysis of respiratory muscles also. So respiratory depression is seen in gelsemium, causes muscle weakness and paralysis. Opium, it shows a classic triad where there is pinpoint pupils, impaired sensorium, usually coma is here, impaired and respiratory depression. So it is also seen in opium poisoning. Dhatura in severe, usually it is not seen, but in severe poisoning, respiratory depression can be seen. CNS depression is there, followed by respiratory depression. But in strychnine, it acts on the spinal cord. It acts on spinal cord and it blocks the inhibitory compound glycine. So inhibition is not there and there is release excitation. So there may be the person will have seizures, convulsions are there. But respiratory depression is not seen. So the correct option here will be B. Respiratory depression is not a feature in strychnine poisoning. So it inhibits the neurotransmitter glycine. So that may be because of sustained contraction. Asphyxia is there, but there is no respiratory depression, right? The next question, question number 11. A child presents with hypotension, respiratory depression, and pinpoint pupils. What is the most appropriate antidote? The option given here are A. Naloxone, B. Flumazenil, C. Naltrexone, and D. Atropine. Again, I think we have whatever we discussed, it will be easy for you to answer also. We already discussed this part. So hypotension, respiratory depression, pinpoint pupil. So what do you think? It indicates diagnosis is opium. Diagnosis is opium poisoning, heroin, morphine. Classic triad is respiratory depression, pinpoint pupils or myiasis, and altered sensorium. And hypotension is also part of it. So the treatment is, the pure antagonist is naloxone. So we give naloxone to treat OPC, to treat the opium poisoning. Or morphine poisoning. Flumazenil again, benzodiazepine. Naltrexone is for long-term use. Abusers can be given alcohol dependence. So it's not for immediate treatment. Atropine, as we have discussed, is for OPC poisoning. So correct option here will be A, naloxone, to treat this child. And the last question is question number 12. The structure shown in the image is located in which layer? The option given here are A, dermis, B, epidermis, C, superficial layer, D, muscle. As you can see, it is the image is that of a tattoo, and tattoo is permanent, best met if it is there in the level of dermis. If it is in the level of epidermis, it will get removed. The temporary tattoos are in the level of epidermis only, superficial ones. But for permanency, it should be at the level of dermis. So option here will be A, dermis, not in the epidermis, superficial layer, or the muscle. So at the level of dermis, it will be permanent. So that's about it. There were 12 questions. I think you must have done pretty well. The questions were not very tough, and all the best wishes. Thank you.